Hi, I'm Trevor Crow-Molyneux.
And I'm Jill Fitzberg, and this is Trevor and Jill Talk, and we have a great, interesting show for you today.
It's amazing. We're so excited today. We're at Dr. Elsa Raskin's office in beautiful Greenwich, and we're talking about something that we think about a lot, which is aging.
We're going to be honest and admit it. We're with Dr. Elsa Raskin. She is a top plastic surgeon. By the way, I've always been curious, before we get talking, like, how did you get into plastic surgery? What was interesting about that for you?
So when I was in medical school, I thought it was the most interesting field because it's very innovative. There's a lot of different aspects to it. One can treat a young child, one can treat an older man, and patients with cancer. So I love it. It's creative, and to this day, I think it's the best job in the world.
And so many amazing changes coming.
Yeah,
and
a lot of technology everywhere to stay on your feet, and there's always new things coming out. New techniques with surgery, or new techniques with lasers. So.
Right, and that's great news for us. But let's start with what you were telling us before, which is kind of how the skin ages, which is kind of a lot to hear, but fortunately then we're going to talk about some ways to combat that.
Some strategies.
Right.
Exactly. So we look beautiful.
So the bad news is that the way we age in our face is we lose fat starting in the early 20s. We lose our baby fat, and if you look at a face of your teenagers versus a face of a person in the 30s, they start looking different. There's something going on. You cannot just tell what it is, but it's not going on. So the fat goes away.
They still look so great.
It looks so great. But the volume starts going away, and especially around the eyes. And so then later on, as you age further, your skin starts thinning out, and it loses elastin, hyaluronic acid, and collagen, the big three. And that process accelerates when you reach menopause, unfortunately. And then
One more blow.
And then really, when you lose your calcium, your bone density also goes, and then you start losing your facial structure. So you can age the loss of volume with fillers, and that works really well in the 40s, 50s. You have wonderful products out there, hyaluronic acids, Irradius, and then of course the Botox, the toxins that are basically preventing you from frowning too much and diminishing the dynamic wrinkles. So those are great, but if you start just doing that as you get older, you think about it, if your skin, which is like leather, atrophies and gets thinner,
More and more so every day.
everything is going to start to stretch out, and you keep putting more and more volume, and at some point you're going to start looking like a caricature.
So you have this
yourself.
thin, like if you were thinking of a piece of plastic, a thin outer layer, kind of put too much push inside,
and then you start getting lumpy, and that's where you don't get the same results you would have gotten with the fillers in your 40s. So this is where this new technology, Profound, comes in, which is radiofrequency microneedling, which basically shrinks your skin and dermis and makes your skin look tighter, firmer, smoother. And it is not a facelift, like we were saying before. It definitely makes the wrinkles and tightens your skin, and it's great for the neck and the jawline especially.
which is the hardest. I talk about it all the time. I remember the Nora Ephron book, I Hate My Neck, back in the day, and I was like, what is she talking about? Oh my goodness.
You get it, but anyway, so there's good news. There's technologies like this, and a lot of my patients come in and say, what can I do for my neck? I don't want surgery. Either it's a bad time in their life, or they don't want to have the scars, or medically they're not even able to ever have surgery, like patients on Coumadin. So this is great. So it's done in the office. You are numbed for an hour next door, and I give you little needles, and then the procedure takes about an hour.
So can almost everybody do Profound?
There is no contraindication. There is no skin type contraindication. You can do this on all skin types. And if you want aspirin, I'll ask you to stop the aspirin before, but everyone can do it.
And the downtime for Profound is how long?
So it's about 5 days of bruising and 1 week of swelling, but most patients go back to work at 5 days.
Okay, and I think we have some before and after pictures, is that right? Do we,
So we're going to show those.
We're going to show you, here's a before picture. Elisa is giving us a little, and this woman.
What age group was this?
Could you tell us how old she was at the time?
I think this patient was 65.
65, and then the after is quite impressive.
Right. It's
Yeah.
like, no, neck is much smoother. It's not as tight as it would have been with a facelift naturally.
Right.
But she was thrilled.
And
how long until she got to
yeah,
that point?
how long is this?
3 months.
Because
3 months,
it's
exactly.
not the kind of thing that your swelling goes away like facelift, and then you
Yeah.
start to see a lot of the. It's a gradual
It's
build
a
up.
gradual build up.
Yeah. So Profound maybe is an interim step for those who maybe down the road want to get a facelift.
Exactly. So what it does, it thickens your skin and makes it smoother, so it prepares you to have a better facelift. So at the end, if I do a facelift on a 45 years old, 50-year-old, she's gonna have a great result because the skin is still smooth.
That is
And
very
how long is that
young.
going to
But
last,
that's
by the
not-
way, on the
but that's
50?
not
No,
what-
seriously,
that's
how
not
long
what
does
we
that
do.
last?
Oh,
Does it last longer if you get it at 50 versus
10 years.
10 years.
So you're going again at 60.
But if you wait too long and your skin is really thin and you do a facelift, what happens is that you're gonna have a pulled look, and it's really a telltale sign that you can tell from far away in the room, and she had a facelift, and no one wants that.
Now, do you have some before and afters on facelifts that you'd like to show us today, or no? Another
Sure,
one?
we can look on your website too.
We can
Yeah,
look on the
website. Right, of course.
Okay, so is it Dr. Elsa Raskin?
ElsaRaskinMD.com.
ElsaRaskinMD.com, and we'll
Yeah.
put all of this up too, because
Yeah.
we were peering at some before, and our mouths our jaws were open like, wow, that's fantastic.
Absolutely.
So this is a whole strategy that you
Yeah.
could put together for somebody, where you say, okay, you're in your late 50s, and maybe you're thinking of a facelift, but before you get the facelift, or maybe you don't quite need the facelift yet, the best thing to do is to start with a few profound treatments, because it also prepares your skin.
It prepares your skin, exactly. And you should have also good skincare, good sunblocks. And if you do have pigmentation, you go to those other lasers like Fraxel. And I have wonderful dermatologists in town I refer to all the time for those. But you should have different tools, because not everyone ages differently.
Right.
And there are women who cannot afford any of those, so I send them to buy a mechanical microneedler on Amazon and do it at home, which is
So
also
that's
works.
fantastic, because I actually have a friend who swears by this. She's extremely diligent, and that it's helped her.
Yeah.
I mean, not to the extent she'd like to go.
Right.
Eventually, I think she'd like to take some more steps. But that's really great, because not everybody wants to, is able to, or should.
It's quite a lot of money.
do all these things.
So if you go on Amazon and buy a 1 millimeter microneedler and you do it at home and then put your hyaluronic acid once a week, it will work. It'll
That's
take a few months, but it will work.
You start to see
Awesome.
some difference.
Right.
Do you recommend someone, maybe a woman in her 40s, come to you and sort of start developing a long-term strategy, sort of a...
I think that's always a good idea. That's always a good idea.
Yeah, there's so many cool things you can do. It's amazing.
So now, people that have Profound, are they still doing other things with you? Do you still do filler?
So
Does it still make sense? Is there anyone who doesn't want to,
very, very good question. What
Botox
happens
anymore?
in my Profound patients is that they start using less fillers. They will still use the Botox, but there will be less need for fillers, especially around the mouth. Because basically you don't have a deep nasolabial fold, and you don't have all those little wrinkle lines here, and you voluminize, your skin gets thicker, so you don't have that, thinness.
So we've talked about this, and one thing that I've been, that I love about you is how honest you are about recovery times, what's really involved, and being frank. And you've tried it, right, yourself?
Yes, I have. I did last summer, and I'm thrilled. I saw a great result. I'm like, okay, I'm good for now. I'm going to do this until I'm in my 60s, and then I'll do the facelift.
And you'll do Profound every year, every other year, 3 years? What are yours?
I think every other year.
Every other year, okay.
But I have a lot of patients who are coming every year.
Because they see that they're seeing the difference.
It's
It
exciting.
depends on, I work full time, so the downtime is significant, but some people have more flexibility, and then, you can definitely do this every year.
So
And the effects are cumulative.
Right.
So it's going to sound a little better and better.
even
better.
Interesting. Interesting. Well, thank you so much for talking to us
welcome.
today. I've learned so much, and Jill and I we do this all the time.
We do, and we're not, a lot of people don't like to, everyone's different. Some people are, will never do anything. Some people will always keep it quiet and private, and of course that's great. We're not really that way, because we feel that it should not be, there's no stigma to it in our mind. Everybody should do what they want to do, and no judgment. And some people love having like the most perfect, beautiful skin quality, and that's the most important thing to them, you know, the skincare that they have.
Right.
Other people don't want to see any wrinkles, and there's like the whole spectrum from what they want to spend, what they feel comfortable with, and all is good.
Right.
So it's nice to know about this option though, because
But
it's,
of course, I mean,
Exactly.
if someone wants a very drastic result,
Mhm.
a facelift is always a better option.
Mm-hmm.
But there is scars involved, there is 2 weeks of downtime, and there is more risks. You know, I mean, minimal risk if someone, you know, chooses a board-certified plastic surgeon. But the result will be a lot more wow. Okay.
and how, okay, so you were saying it lasts about 10 years. Does it last about 10 years no matter what age you are when you get it? And
So
how,
not
how
really,
late
so-
can you keep, how long can you do this
So if
for?
your skin is good, it will last about 10 years. But if you're older, it will last, you know, it depends on the areas and how it's been done, probably less than 5 years.
Wow.
People think it's forever. It's not forever. It's not like a rhinoplasty or...
Because you're fighting the conflicting
Yeah.
sources.
Your
of-
bone
Because
is
it's-
still
right.
shrinking.
And the new trends now with facelifts is to actually put fat in your
Oh,
face when you
right.
do it. So you do fat grafting. So again, you revoluminize and go back to that baby face we were talking about in the beginning.
So what can
Wow.
people expect? I guess this is what, when someone comes in to you and they say, I feel like I'm aging and I want to look younger, do people, you know, generally look 5 years, 10 years younger, or is it just that they look fresher? How do you answer that when someone comes in and says, how much younger will I look, doctor?
For
You
what
know,
modality?
well, because everything else-
For what modality?
For a facelift, because I feel like even if you have a facelift, look, there's all kinds of parts of us, right? Our
So-
hair, our
Right.
skin, our
So I
body,
look at
everything
I
is changing.
look at everything because sometimes there's telltale signs of aging. If someone has very thin hair, I really look at their skin quality. And if the skin quality is already very thin and you can see every single vein and all that, I tell them, well, facelift would be nice, but it might not give you the impact you want. And then I might suggest other things along the way.
So look up Dr. ElsaRaskinMD.com. You can see a lot of before and after pictures on her website. It is truly jaw-dropping, amazing. Your work is beautiful. And really think about a long-term strategy. Nothing has to be dramatic. You can do things over time. And it doesn't necessarily have to be a facelift. And Dr. Raskin can come up with things that can go with your budget, your recovery time, your lifestyle, right, and your age. So
I'm just
really
gonna
excited
tell
to
you,
talk to you.
give you the true skinny.
Yeah, it's pretty cool.
That's what I like.
Wonderful. Well, thank you for talking to us. We have a fabulous makeup artist who's going to
We
help
do.
us talk about summer makeup. Should we walk over and sit next to Kathleen? Here we go.
All right, I'm
you
coming
want
in.
to come
I'm
over?
coming in.
You're coming in. Coming in. So, Kathleen
Kathleen Fillion.
Kathleen is she's got you can find her on it's Instagram at Makeup by Kathleen Fillion.
Correct.
Is that right?
Yep.
So,
You're
and,
currently working with Warren Chacomi here in Greenwich.
oh, that's a great salon.
Yeah.
It's a beautiful salon.
Yeah.
Yes.
And
Oh, I think you need to
think-
move in. So maybe you two
okay.
need to share now.
Maybe
All right.
sit over. There we go. I can sit.
Sorry.
next to you. And you recently worked with the hashtag #SevenMeat Tribe.
That was amazing.
Wow.
That was a big photo shoot. Stop the Torture. It is to basically end the trade of the meat, the Yulin, and it just went on. And
You're talking about animals,
And
dogs, and
dogs.
cats as well, or
yes,
dogs.
they basically kill the animals for their own consumption.
It's incredible.
Yes.
This is really a tough one.
This is
This
just
is
for a lot of
just
people.
in China.
Just in China.
Okay, so you raised funds to bring awareness to this issue.
No,
No.
we're not raising the funds. We basically did the campaign
Okay.
to raise the awareness.
Got it.
And we used a lot of local women, local powerful women, who really wanted to raise the awareness out and around Instagram, Facebook, things like that.
This is being done. So these
Yes.
are animals to my friend Brooke Bonsack. Great photo shoot with her dog Duke. She's a pretty incredible community leader, but the thing is that this is just a deplorable, disgusting practice where animals are caged and beaten and eaten, right? Correct? And so we're trying to bring, with this campaign, lots of awareness to stop this. And how is that go? Like, how is that working, and how does that translate over there?
It's basically, we have to be very careful about bringing it over there and basically the methods that we're using. But we're really getting a really good reaction here in the United States and here in this area. We've been on Channel 12.
Wow.
We have been on ABC.
CT style.
CT style. So
You're making an impact.
we're trying to make an impact,
starting
correct.
to be understanding that this is really an issue and it's happening, and the more noise we can make about it may impact.
People can sign the petition on the Humane Society website.
Okay.
The Humane Society Stop the Torture. We'll put that
We'll
up.
put that up as
Yeah,
well.
we'll put it
'Cause
on.
this is absolutely.
It's just
It's
disgusting.
shocking.
Yes.
And then also people can post their own photos of them using the hashtag with their pets
Yes.
on Instagram and Facebook, and that will also help create some traction.
The hashtag is with their. The
Stop
hashtag
the
is
torture.
stop the torture.
Stop the torture.
Stop the torture. So, well, thank you so much for bringing this to us, this to our attention.
Are
This
you?
is
Was this
horrifying.
personal for you? Like,
This,
are you a big
very much.
fan?
The thing that it was very serendipitous how the whole thing came together also, because I am a 29-year vegetarian.
Wow.
And I started this a long time ago, and it was something that came from within me. It was something that I can do to help the rest of the world. And, you know, when you start doing things like that, these things naturally gravitate to you. And that's how we all came together.
Right. So
That's
hashtag
important.
stop the torture,
Yes.
and you can post pictures and learn more about this campaign
Humane
to
Society.
end this horrible, ridiculous, unacceptable
HumaneSociety.org.
torture.
So, well, let's talk about some kind of fun stuff since we're in the middle of summer. And one of my problems in the middle of summer is I feel like I'm melting, right? Do you feel
Yes.
that way, Jill?
I never. I
makeup,
hate
everything.
going to like very dressy occasions in the summer or anything else because I feel like by the time I could be.
Yeah.
This is going to be an easier conversation, but yeah, summertime makeup. The biggest thing that we want to remember is primers. Primers. Start out with a primer.
And what does that
And-
mean exactly? Is that what are your favorite primers?
Favorite primers, I would say, YSL,
Why is that?
Chantecaille,
Okay.
and Laura Mercier.
Okay.
Those are
I
really
like
good
Laura.
primers.
Any drugstore brands that you go there or not?
I don't.
Smashbox. Does that?
Smashbox is a good one, and Makeup Forever is another
Makeup
good
Good
one.
one. Okay.
And
that will
still
hold
up.
your makeup on, help you melt a little less, or
It'll
what?
help you melt a little less. It'll keep the foundation less. The biggest impact that you want to make is less is more.
Less
and the
is more.
heat.
I like that.
Okay.
And
Yeah.
can I also say, I guess, as we're in the discussion of facial aging and everything else, also makeup, you know, as you age, kind of, there might be 18 products, but the look of less is more
Right.
seems
And-
to
and
be
exactly
helpful
right.
too, I think.
Exactly that. I totally agree. When you're being more mature about your makeup choices, we want to basically choose a brighter eyeliner. Okay? You always want to go with a navy
Love that.
because
Oh.
navy brightens.
Syndicate it.
And
Black is hard sometimes.
black
well, for
could be
me,
almost
yeah.
too harsh. If you're going out at night, if it's a big event, that's fine. But navy during the day, dark midnight blue is really
It's
really
good.
nice.
On any eye color. Any
And
skin
yeah,
color.
and basically any
Interesting.
yeah.
What about lipsticks? 'Cause, you know, like
Lipsticks.
there's the beautiful reds and pinks, and sometimes I find that kind of
Is that
hard
too
now.
heavy
And
the
as
hard,
we
the
get
darker
older?
ones.
It's
But I love them.
it's too match for a daytime look. You want to.
That's
So
good.
that's the
Yeah.
biggest thing. and that's actually that's a Bobbi Brown tip too.
She always
that-
had the prettiest makeup too, like the
Yeah,
palettes that were
I
natural.
love the
and
soft browns, but
and
in the
fresh.
summers I tend to go more pinks and corals. So it's a little bit more.
correct,
you know,
correct.
that's
But still, if you start out with a lip liner to match your lip,
lip liner.
and then go over it, you'll be safe.
So what's the biggest mistake you see people make? Not doing them any favors that we should all know about.
Over powdering.
Really?
Over
Yeah,
powdering.
that's
Which in the
a
summer you really want to sometimes
And-
find yourself doing, right? To take all the
because basically you're powdering to take the
Sheen
sheen away.
Mhm.
You want to use blotting papers and things
Blotting
like that.
papers. Do you think so?
I'm
Do
so
that?
addicted.
I hate to do that.
I just went buying blotting paper.
Or
Is that an Ulta, Sephora, whatever?
Yes, Ulta, Sephora, that you can get. Actually, I have to be honest, that is one of my drugstore favorites.
Dewy, which is kind of pretty, and then just slicky.
Exactly when you want to pat in.
Pat the papers.
Pat in. You could pat with the papers
And
or
not
pat
too much
with your
powder.
finger, and not too much powder.
Not
I'm
the
not
setting
saying no
powders
powder.
and sprays
Yeah.
and all those things.
Oh,
Are they
I'm a
good?
big fan. The other more natural way to set the makeup in without doing it cakey.
Yeah.
Are you ready? Rose water.
Rose water.
Plain rose
like
water.
a little spray.
Yep, my favorite one is Trader
Interesting.
Joe's.
Really?
I have to be honest.
Okay.
Yep, plain
Here's my
rose
daily
water.
visit
And
anyway.
that's where you
Yeah.
get a nice dewy finish. You could do that after your skincare, before your skincare. I do it at the beach even, just
I
to
like it.
freshen up. Yep,
That's really wonderful.
rose water.
So when we were at the Greenwich International Film Festival, we had so much fun. We met Lauryn Hill, which of course just made me so happy. And she was wearing the coolest like turquoise eyeliner. So I'm wearing turquoise. She really motivated me to try some different colors.
That looks great.
It
That's
does,
really
and the
cool.
way you did it with the darker liner, and then you did the turquoise right behind it.
Motivated.
You did it
So
very,
that's cool.
very
Thank you.
well. That's
Kinda
very
fun,
cool.
right?
It's a good summer bright
Right?
look.
A little
Yep.
bright look. But
Thanks,
thank
Lauren.
you. Thanks, Lauren.
So once we get our profound and our faces, like if we really want to stay younger looking as we grow older,
Yeah.
obviously skin quality number one, if we can achieve that, and then keeping it kind of dewy, fresh, natural looking, a
Exactly.
little brightening in the
With
eye
a little
area.
brightening in the eyes and lips and cheeks.
I have a
good-
question.
Yes.
What about
From the
matte
30 something.
lipstick? 36.
Oh.
Almost 40. Might have to come in here.
Matte lipstick is great. It's one of my favorites. Okay, especially for an evening out.
Yeah.
But when we were talking about youthful, you have to balance that matte lipstick. You have to be very careful with how you do it with the rest of the skin. If you're going to do it with a dewy skin, a matte lipstick is amazing. It's going to stay on all day. That I'm a big fan of the stay all day lipsticks. Just
Interesting.
you have to feel your way around them. The type of makeup artist I am is to make everybody comfortable. I want I want to polish you, I want to bring out the best you there is. So I want you to be comfortable. And a lot of people sort of say, oh, I don't like the matte lipstick, it's so drying.
It's weird,
it's-
but I
it's-
kind of like it.
And that's
It can look very hot.
yes,
just
Kind of
saw it.
exactly.
It can be very chic, and
Yeah.
it's sort of it's new. It feels
You could
very
do a
modern.
whole face around it.
Yeah,
Exactly.
Very modern.
That's awesome. Thank you
Cool,
so much.
thank you,
All right,
Kathleen.
you're
Really
welcome.
appreciate
Thanks
it.
for
Nice
your
to
will we
meet
see more
everyone.
work on the Stop the
Yes.
Torture, more photos coming?
And
or-
definitely,
Yeah,
you're
just go
gonna
to
see a
hashtag.
lot. Just go hashtag
Stop the
stop the torture. Just want to say everything correctly.
At the Humane, and we'll put all this on our Facebook page, and also we'll put your
Yes,
Instagram
and
follow.
everybody's
makeup.
pictures
by
are
Kathleen.
on my Instagram page.
Fantastic.
Everyone.
Kathleen, thank you so
Thanks
much.
Thank you very
Appreciate
much.
it.
Yeah. So
All right,
we've
so
had
let's-
a great show today.
Yeah,
It's
we
a lot
have.
going. Well, first of all, the rescue in Thailand, how amazing. God, it just makes you feel good. And I don't know if anybody saw the videos on YouTube and how difficult it was getting those people through these tunnels that were like
If you have any sort of claustrophobia or fear of underwater, which I
that would have killed me.
it was so narrow,
Yeah.
and those kids and then
It was
the poor
incredible.
seal that died, even trying to help them. The
I didn't
gentleman
know that.
One gentleman didn't have
I
enough
actually didn't
oxygen,
know
brought
that.
them oxygen, and then didn't have enough oxygen. So one man died, but actually a few days ago.
Mm-hmm.
So it was so terrifying. It's so.
I did not.
I'm sure there'll be a film or something because it's
It's an
unlike.
incredible story. A couple interesting things. Miss America,
One of Miss Massachusetts.
Miss Massachusetts, she dropped out because she heard a hashtag Me Too joke, which we were sort of
at
proud
the
that
pageant. Yeah, we were
she-
proud of her.
she stood up.
I just want to say, I feel like there's so much backlash coming to people who have some of the Me Too issues. And a lot of people are almost starting to make fun of people who say
Yeah.
that, and they're sensitive, and that's
Yeah,
not
that's-
okay for
yeah.
almost every woman that comes forward, and there's always an exception. with a harassment at
courage.
work or a sexual assault or maybe even a rape, it takes unbelievable courage, and there's so much fear and there's so much consequence. So cut that out.
Yeah, we don't like that at all.
So kudos to her, because she said no, we can't be part of this. Someone's making fun of it. But she was raped.
She was. Oh, it was a terrible story, but we give her credit for standing up. We are delighted to hear that George Clooney is okay. He was in a motorbike.
We're always delighted, but
accident.
especially now.
He was in a motorbike crash in Sardinia. I think he's on set.
Did you see anybody hear the video of Amal addressing him? If you have not seen this,
So
he was honored by the American Film Institute. She came out looking as stunning as ever, made this most heartfelt speech about what a great man, father, husband, friend he is. I had tears in my eyes. They're like, to me,
So beautiful.
they are to me the king and queen. I mean, so
Power couple.
watch this. It will like reinforce your faith in,
So today,
I don't
2
know,
o'clock,
love.
England versus Croatia. If you're a
Huge.
World Cup person,
Huge.
this is big. Oh my gosh. we gotta
France
watch.
versus either England or Croatia in the final.
Can you imagine
This is
France versus England?
enormous.
It's like Agent Court all over. Anyway,
I think it's really fun.
I think we can wrap up. Before we wrap up, I want to say we lost a great man about 10 days ago, almost 2 weeks ago. My brother-in-law, Van Skank, died after a really courageous battle against cancer. He leaves my sister, who's beautiful and wonderful, and that was the love of her life, and my incredible nephew, Hib. So rest in peace, Van. We loved you very much.
Really, really, I'm so sorry. He was
Thanks.
awesome, and
He's
it just
amazing.
brings us to say again, we say this all the time to our friends, we're trying to say this all the time on our show, get screened for colon cancer, breast cancer, anything else you
Yes.
need to do. You never know. You might save your life, and
Yeah.
you might save your friend's
And
life.
Jill's working on My Bosom Buddies,
I
which is
am.
again going to get your mammography. I just scheduled my colonoscopy coming up in a few weeks.
Tell your friend,
So, yeah.
honestly, and you know what, I know you'll understand this as a surgeon, a breast surgeon friend of mine has said, I cannot tell you how many times I've said to people, if you had only come to me 6 months earlier or a year earlier, we would be going down a different path. I'm literally getting scalped.
Yes. So a big Elisa Gorman, Elsa Raskin, Dr. Raskin. Remember, look her up on the web, Elsa Raskin, MD.com. Kathleen Fillion, and of course her good hard work for hashtag Stop the Torture and the Humane Society. So
That's
everybody have a
awesome.
blessed week. We're going to be doing some fun things. We're going to get back to you with more exciting stuff. We even have a bathing suit show coming up.
No,
so.
you have a bathing suit show. I might film this one.
All right.
But